Our reporter Chriselda Lewis, who is at the Charlotte Maxeke Hospital emergency unit, dealing with these patients coming in, critical patients, patients that are seriously affected by COVID-19. Chriselda, a very good morning to you. Important perspective to have with regards to frontline workers dealing with COVID-19. What are you witnessing there?
Well, that's right, Blaine. A very good morning to you from the Charlotte Maxeke COVID-19 emergency unit. This is the high-risk area where I am at the moment that deals with some of the most critical patients. There are some patients here at the Charlotte Maxeke Hospital, but Blaine, due to privacy concerns, obviously we're not going to speak to them at this point. The point where I'm standing at the moment is at the center of this particular ward, also to minimize the risk for my colleague and I, video journalist Tulo Manare, pertaining to this particular area where some of the high-risk patients are being brought in. And you see this particular ward where I am at the moment, all of this is basically put into three areas where you have different cubicles that will deal with patients on a different aspect pertaining to their condition at a particular time. So this particular hospital, Blaine, has been seeing about 400 patients presenting with symptoms of COVID-19 since the start of the outbreak of the global pandemic. And currently, there are 230 COVID patients currently here, and 11 that are in the intensive care unit. And indeed, as you did point out, these are the men and women who are at the center of fighting this COVID-19 pandemic. And I know here at the Charlotte Maxeke Hospital, there have been quite a number of infections of personnel here throughout the country and throughout the world, of course. So we'd really want to highlight that here today, Blaine. Those who've really put themselves on the line in order to ensure that they're in the front line of fighting this pandemic here at the Charlotte Maxeke Hospital. I'm going to show you something now, Blaine, which I think is something that we really haven't seen at this point. Just a few moments ago, I'm going to ask my colleague Tulo Manare to come with me. Just a few moments ago, we had one of the nurses or one of the personnel here who said she was basically feeling some symptoms of COVID-19. So her colleague is about to test her at the moment, and we'll go in, and this is what it is like on a daily basis, where those who are in the front line, in the middle of their duties, they basically, some of them start, having these symptoms related to COVID-19, and their colleagues who work with them are the ones who have to assist in instances such as this. We'll come in here. It's about to happen now. Dr. Anele Ntanjana, taking care of her colleague there. She has agreed at this stage to allow us into this particular test. Her colleague this morning saying that she has some symptoms of COVID-19, and it's her very colleague. So it paints a picture there, Blaine, of exactly what these doctors, nurses, personnel at the various hospitals around the country have to deal with, while they themselves have to keep safe and make sure that they fight this pandemic from the front line. They themselves are at high risk. Their colleagues are at high risk. And let me try and bring in Dr. Anele Ntanjana just to speak to her. Doc, this must be extremely difficult. Every morning, every evening, 23 hours of work. And one of your colleagues this morning with symptoms of COVID-19, how are you all coping here?
Yeah, so it's been a sort of ebb and flow since the beginning of the pandemic reaching South Africa, that we've had every now and then that colleagues have come in with symptoms that we've had to then test and send home. So it's an obvious reality now for us that we're quite obviously exposed. With every patient we see, with every patient that we screen, and even with our colleagues who have joined us just to help us out, just to add to our staff, to help us with the patient load, that even they know that they are putting themselves at risk as well. So there is some anxiety that is associated with it. But we have sort of banded together, and we do try and support each other as much as possible. And if someone does come in with symptoms, we don't let them stay and continue working. We do the testing ourselves for their convenience, and then we'll send them home thereafter to await results so that they don't have to stay here. Yeah.
And ma'am, this must be, thank you so much for allowing us to speak to you. What is it like being at the front line of fighting this pandemic? And now you find yourself at risk as well this morning, having to have your colleague take a swab because you're unsure of exactly what symptoms you may be experiencing.
It is really difficult, especially when you are coming out to help people and you are put in such a situation. And for me, it was very frightening having to test, not because I have to, it's more because I have to stay at home and can't come to the hospital now and help my patients. And now my colleagues are going to be short-staffed and put at a higher risk as well.
And I mean, Dr. Ntanjana, maybe you could just explain to us, I mean, every single day having to leave here, go back to your families, and not knowing, you know, what you may have contracted. I mean, that must be excruciating.
Yeah, so I myself go through a very sort of vigorous process, especially with putting on the PPE, taking off the PPE, and even beyond that, I still change the clothes that I've come into the hospital with, change into other clothes at the end of the day. And when I step into home, touch nothing, go straight to the shower. And it's only my immediate family that I have been seeing over the last couple of months. My extended family I am not seeing at all. Especially the elderly members of my family, to not put them at risk because I know that I am high risk by virtue of me working here. So it is a reality for all of us that, you know, that the families that we go home to, that we would be exposing them. So some people, as I've mentioned before, have not seen their families in a while. Some people have moved out of home and into a place where, unfortunately, they've been staying alone. Until awaiting, you know, the curve to sort of flatten. So it is difficult, but these are the changes that we have to make to keep our families safe, to keep ourselves safe as well, and to continue doing our jobs, as best as we can.
Dr. Ntanjana, there was one particular issue that has been a bone of contention in South Africa, the rebanning of alcohol. I know that Charlotte Maxeke Hospital was one of those that started seeing a significant increase in trauma cases as a result of, bottle stores being opened. What is the situation currently?
So since having the alcohol ban again, it's helped us considerably. Trauma has seen much less cases. It's opened up ICU beds for us. It's opened up more bed space in the hospital for us and for the patients that are coming in more critically ill. And this is what we're seeing now, is that we've got way more critically ill patients coming in with COVID-19. And we needed the space. And it's not only that, but also diabetic patients, epilepsy patients, pancreatitis patients, all of those things that are affected by alcohol as well will then decrease. That is the effect that it's had. It's I know it's a bit frustrating for some members of the public, but it is something that we have desperately needed in this time, because we need more staff, we need more bed space, and we need as much resources as we can have. And if we can do that simply by having an increase in the ban, that's what we've needed, yeah.
Dr. Ntanjana, if you could just walk with me here just for a second, just walk us through exactly where we are at the moment. Is high risk, is it high risk cubicle 1? So the cubicle where we are at the moment would be the cubicle that would deal with a high risk patient.
Yes, exactly. So we'd be dealing with a patient that is markedly high risk, because they require aerosolizing procedures, things like intubating the patient or putting them on a machine to help them breathe. Those kinds of procedures are done in the high-risk cubicles. There are other cubicles down the passage that are for patients that are still COVID-19 suspects, but otherwise do not require as much invasive procedures or as much critical care cover. Yeah.
Dr. Ntanjana, thank you very much indeed for your time. We'll speak to you again a bit later on. Thanks indeed for the work that you do and the work.
It is unfortunate that we lost that link, but this is what the SABC does very, very well, is that we pull back the curtain. Chriselda and the team pulling back the curtain, giving us a window into the reality of on the ground, what people are currently going through. We need the best warriors on the front line to fight this. No doubt we all need to be invested in the fight against COVID-19, and by all accounts, we can change the calculus in terms of where this is heading.